Director for Black Health Matters. Thank you for joining this session on caring for Black skin. We now live in a time where both men and women want to always be camera ready. Our next presenter, Dr. Camille Cash, has made some groundbreaking strides in making it possible for cosmetic and reconstructive surgery to be more accessible and safer for people of color. One of the top plastic surgeons in Houston, Texas, Dr. Cash, describes her work as double satisfaction, especially when she sees her patients both looking better and feeling better about themselves. Dr. Cash is the first female African-American plastic surgeon in the state of Texas to be certified by the American Board of Surgery and the American Board of Plastic Surgery. Dr. Cash graduated magna cum laude from Howard University in Washington, D.C., then returned to Houston and earned her MD from Baylor College of Medicine. And even with a thriving private practice and an active family life, Dr. Cash finds time to devote to causes that are important to her. She is on the board of directors of the Sisters Network, Inc., a group that seeks to make reconstructive surgery more readily available to underserved minority communities. Dr. Cash, you have our undivided attention.
Well, thank you for that warm welcome. I'm very happy to be here. I'm going to go ahead and see if I can share my screen to get my presentation going. All righty. Well, good morning. I guess it's still morning. My name is Dr. Camille Cash. As was mentioned, I am a plastic surgeon here in Houston, Texas. And I started my practice in 2002, which was almost 20 years ago. And as the first African-American female plastic surgeon in the state, at that time, there weren't a lot of role models for me. There were not a lot of patients that were seeking treatment for cosmetic procedures just yet. But I knew that there was a big interest for patients of color. And I was attracted to not only plastic surgery, but the treatment of skin because I suffered from acne as a teen. I still suffer from acne actually as an adult, but I had severe acne. And so part of my practice of plastic surgery has always included skincare, and that's been an important part of my practice. So today we're going to talk a little bit about how characteristics for Black skin can really create some of the problems and the issues and concerns that we face. Those issues are pigmentations and discoloration, acne, razor bumps, also known as pseudofolliculitis barbae, how we age, and what treatments are available for us to address our particular skin needs. And so how do you classify Black skin, or how do you classify skin at all? In the medical community, we often start with the Fitzpatrick skin type scale, which looks at different skin types and how they respond to light. So typically you'll look at a scale from 1 to 6, and patients with a skin type of 1 are highly sensitive to the skin and typically burn and do not tan. And if you look at skin type 6, you're talking about patients who typically have mild sensitivity to the sun and very rarely, if ever, burn. And you can see that darker skin types are typically associated with African American skin. However, we all know that African American skin is extremely diverse. And Maya Angelou has this beautiful quote that really explains the diversity and how we should embrace it and how it's beautiful. So all of our skin, and Black skin, as you may call it, is very variable. And so you may think that all African Americans are type 5 and 6, but if you look at this chart and this photograph, we know many patients or friends, family members that come in all different hues, and we're not classified in any one particular area. So the Fitzpatrick scale is important for understanding how patient's skin responds to the sun, but it should not be classified, used as a classification for race. It's really just a guide for how patients' skin, again, responds to sunlight. Then also having to figure out what type of skin do you have? Do you have oily skin? Do you have acneic skin? Do you have dry skin? So there's a very wide variety of skin types for patients of color. But there are some unique characteristics of Black skin that, again, can give us some of our benefits and can also give us some of the problems that we face commonly. So we typically have patients of color, Black skin has a thicker stratum corneum. And the stratum corneum is the outer layer of the epidermis. And when you have too many cells heaped up in this area, you can have a dull appearance to the skin or rough texture of the skin. This can lead to buildup of oil, clogging of pores, and clogging of the hair follicles, which can lead to acne and pseudofolliculitis barbae. We're also more prone to discolorations or dyschromias, including hyperpigmentation or hypopigmentation. Our skin may be a little bit more sensitive than the average skin to sun, makeup, deodorants, and medications. There's a little bit of uniqueness about Black skin when it comes to acne. And some of these statements hold true, but some of them are not completely accurate. Acne in Black skin tends to present more as inflammatory acne, pustules and papules versus non-inflammatory acne, such as whiteheads or blackhead. We tend to have fewer severe acne lesions, which I kind of have an asterisk next to because, again, we have patients that will suffer from all types of acne, nodule, cystic acne, pustular acne. Scarring for us tends to be more in the hyperpigmentation versus the ice pick type scarring. We do have a higher chance of keloiding, especially in the chest and the back. And we don't typically suffer from rosacea, which is a redness of the skin and less common in African Americans. But let's look at the anatomy of the skin. This diagram illustrates the layers of the skin and some of the organs that we find inside the skin cell. So this upper layer, this beige color, is the epidermis, and in the pinker layer is the dermis. Inside the dermis, we have the base of the hair follicles, we have sebaceous oil glands, and we have blood vessels that are coming through the skin. We also have pores that come from the sweat glands. This diagram on the right is a picture of the epidermis. So this is the epidermal layer right here. So the stratum corneum, as we talked about a little bit while ago, is a little bit thicker in patients of color. So this is the area of the skin, the epidermis, where the dead skin cells live. And if we have a heaped up amount of skin cells that are dead, they'll clog our pores, they'll lead again to that dull complexion, uneven skin tone. As you get a little bit deeper into the dermis, this is where the melanocytes live. These are the pigment producing skin cells, and they're deeper within the dermis. But this area here, these 5 layers are the layers of the epidermis. And again, this outer layer is this thicker layer in African Americans. And this is a histological slide of skin. Again, this outer layer, this little kind of fuzzy layer, is the epidermis. Then you'll have this deeper layer, that's the dermis. So for skin of color, we tend to find more heaped up cells, a thicker layer that can be disorganized and disorderly. In the dermis, we may have areas of the melanocytes that are producing the pigmentation. And how acne forms is it typically starts with a sebaceous gland that can be clogged by dead skin cells, again, in that outer layer. The oil glands get blocked, and the oil blockage combined with the extra skin can block the hair follicle or the oil gland and create a little bacterial infection and inflammation. And as acne begins to get worse, we can have rupture of the acne into the skin, more inflammation, more infection. And again, that can lead to hyperpigmentation. Pseudofolliculitis barbae is an irritating skin condition that is caused by ingrown hairs on the face and the neck and other parts of the body. This is typically seen in African American men, and it's caused by an ingrown hair that because African Americans have curly hair, when you cut it and it regrows, it curls back into the skin and creates inflammation into the skin and create pustules and create nodules, and that can create scarring and pigmentation. This can be a result of using dull razors or sharp razors, or poor cleansing of the skin before you shave, or nicking the skin from electric razors. And so some treatment that patients can do at home is some proper skin and shaving hygiene. So men are advised not to shave too closely. So maybe leaving a little bit of a stubble will prevent that hair follicle, that hair from regrowing back into the surface of the skin. Using an electric razor versus a razor blade, cleaning your skin frequently, exfoliating the skin with glycolic or salicylic acid washes, or using benzoyl peroxide to help decrease the bacterial count in the skin cells. And this can help decrease the inflammation of pseudofolliculitis barbae. Now, I've talked briefly about post-inflammatory hyperpigmentation, or PIH, and this is a typical response in patients of color, and it can be quite common after any minor or major trauma, such as a nick, a cut, a scrape, a burn, acne scarring, or even hormonal changes or sun exposure. Cleansing the skin can be a good way to control oil production, fight acne, and pseudofolliculitis barbae. But the studies have found that the post-inflammatory hyperpigmentation is actually even more distressing than the acne or the folliculitis itself. And so there's a lot of attention placed in treating post-inflammatory hyperpigmentation for patients of color. There are typical topical skincare products that can be used, such as hydroquinone, which helps to decrease the production of melanin. So for dark pigmentation or dark spots, hydroquinone can be used. It can be used in an over-the-counter preparation, which is about a 2%, and anything greater than 4% is typically prescribed by a physician, and this can help decrease the pigmentation and the production of melanin. This is typically a product that can be used for a short period of time, no longer than 3 months, but can help control pigmentation and even skin tone. Retin-As and retinols are derivatives of vitamin A and can be used to speed skin cell turnover, rapidly exfoliating their skin and decreasing that buildup of dead skin cells within the hair follicle and the oil in the sebaceous gland. Other topical preparations can include glycolic acids, azelaic acid, that can also gently exfoliate the skin, decrease the dead skin cells, and speed over their skin turnover. Kojic acid is another topical product that can be used, that is a natural skin lightener that can be used as an alternative to hydroquinone. Benzoyl peroxide is a product that can be used for acne and for pseudofolliculitis to help decrease the bacteria that's found on the skin. And of course, we need to use sunscreen to help prevent aging as well as to decrease pigmentation. So treatment for pseudofolliculitis barbae includes the skin and shaving hygiene protocols and the topical medications that I just described. But other treatment options are also available for this condition, but they're typically done under the direction of a physician or a medical expert, such as an esthetician or a laser therapist. So in my practice, we will use lasers to help decrease the growth of the hair, decrease the pustular breakouts, which decreases the inflammation and then therefore decreases discoloration. You can see this patient has a lot of pustules, more discoloration from the ingrown hairs and the folliculitis that has been successfully treated and improved with a laser. In selecting the type of laser for patients of color, it's important to use a laser that is what we call colorblind, meaning the laser is not going to target the pigment in the skin, but it's going to actually target the hair follicle, which is deeper in the dermis, so you don't have the risk of hyperpigmentation with these types of lasers. One example is a 1064 YAG laser that can be effective for treating hair growth, pigmentation in patients of all skin types. And this is an example of a patient that was treated for folliculitis, And by treating the growth of the hair and the inflammation, that discoloration is improved and the growth of the hair can be slowed. Post-inflammatory hyperpigmentation can also be treated safely with lasers, again, under the guide of a medical expert. This is a patient with acne and inflammation and old pigmentation left over from the acne. So this is the typical acne scarring that patients of color have because of a result of acne. And this can be improved safely with the use of lasers. Again, be cautious and make sure that your provider is experienced with patients of color. Another patient who has post-inflammatory hyperpigmentation, both due to acne and then also due to sun exposure, that has been successfully treated with a chemical peel under the guide of my esthetician, who's an expert in skin of color. And so it's a misnomer that African Americans don't age. You know, the old adage, black don't crack, is true to a certain degree, but we do age. And the majority of visible aging is caused by sun exposure. And that's another misnomer, is that African Americans don't need to use sunscreen, which is very far from the truth. We need to take care of our skin and protect it, just like patients, Caucasian patients. And so with the aging process, you can create a buildup of dead skin cells that again create a rough complexion or uneven skin tone. The melanocytes, or the pigment producing skin cells, can be erratic and create splotchy skin. The dermis can thin as we get a little bit older, and our collagen and elastin becomes brittle and decreases in production. And collagen and elastin are what give skin their springy and youthful tautness. It is true that African Americans, Latin Americans, Asians, and Native Americans will age slower as compared to Caucasian patients. And typically we see aging 2 decades later, signs of aging 2 decades later in patients of color versus Caucasians. And so the fine lines and wrinkles that Caucasians may see in their 30s, 40s, and 50s, skin of color may not demonstrate that until much later, 50s, 60s, or beyond. And if you take care of your skin, you can slow the aging process. And the importance of collagen in maintaining a youthful appearance is that the collagen bundles are robust and well hydrated when we're younger, giving a plush, plump, and taut appearance to the skin. As we get older, our collagen and elastin start to decrease and thin. The moisture or the hydration in the skin starts to fade, and we start to see more lines and wrinkles in the development of folds in the skin. So it's important to understand how these changes can be affected. And UV light helps to precipitate the damage to the DNA of cells, which can accelerate the loss of collagen and elastin, leading to fine lines and wrinkles. And it can also disrupt the function of melanocytes, or the pigment producing skin cells, that can create melasma, blotchiness to the skin, or age spots. Anti-aging treatments are used to address these areas of fine lines and wrinkles, skin laxity, as well as pigmentation. For fine lines and wrinkles, neurotoxins such as Botox are very effective. Fillers can be used to restore volume and restore a collagen response. And using a dedicated skincare to decrease the buildup of skin cells help to improve blood supply to the skin and giving a more vibrant or bright complexion are all important aspects of anti-aging. There are also treatments that can be used in the office under the guide of a medical expert, including microneedling, radiofrequency tightening, and lasers to help decrease aging and give rejuvenation to the skin. And typically we'll have patients that will have an at-home regimen as well that will come into the office for monthly, quarterly, or even annual treatments that can be a little bit more aggressive in slowing the aging process. So in this patient, you can see some signs of facial aging. She's got forehead lines that go across. She's got lines in the glabella, or in between the eyebrows, and we call those the 11s. You can see she's got volume loss in the mid-face or the cheeks, where the eyelid and the cheek comes together. That creates a more sunken appearance and a more prominence to the fold of the nose, from the nose to the mouth. This is called the nasolabial fold, or also known as the parentheses. And in this patient, I used neurotoxins such as Botox or Dysport to help relax the forehead muscles and the muscles in the glabella. And you can see in her after result at the 3/4 view, these fine lines are definitely softer and minimized by the use of a neurotoxin. For the mid-face volume loss, I used a filler to restore plumpness and volume and to stimulate collagen production in the cheeks. And that helps to create a more natural balance to the face without making the patient look weird or unusual. It helps to offset some of the skin laxity that occurs as we get older. This is another example in a male of using a neurotoxin to decrease these fine lines and wrinkles in the forehead. And I have patients that ask me, how soon should I start using a neurotoxin such as Botox or Dysport? And I tell patients that really aging, visible signs of aging typically start in our 30s, where we may start seeing fine lines, subtle. They're more prominent when we animate or we move our face, and maybe less noticeable when we're at rest. And those are great lines to be treated with neurotoxins such as Botox. We may also start seeing a little bit of shadowing as we start creating some volume loss or some pigmentation in the skin. Melasma is another skin condition that African Americans suffer with. They are characterized by brown or blue-gray patches of freckle-like spots on the face. It has been called the mask of pregnancy, although it is present in both men and women and not necessarily associated with pregnancy. Melasma happens because you have an overproduction of pigmentation caused by the melanocytes, that are the skin cells that make the color of your skin. These are some common triggers for patients. Again, it can be due to hormones, but it can also be genetic. It can be due to sun exposure, inflammation, or certain drugs. This is a patient that has a typical presentation of melasma with pigmentation in the cheek, as well as on the sides of the forehead, typically areas where we get the greatest sun exposure. But this can be safely addressed with the use of topical skincare products, as well as chemical peels to help brighten and lighten skin. This is another patient that has hyperpigmentation due to melasma that has been successfully treated with a chemical peel and with skincare products, as well as sunscreen. Dermatosis papilla nigra are benign epidermal growths that can present as hyperpigmented skin tags that occur on the face. It can also occur in the neck or in the folds of skin. These are benign, but they're age spots, and they can start in clusters and get larger as time goes on. They typically can be seen again in the folds of skin and can be successfully treated with laser therapy or with cauterization of these benign growths. Keloids are scars that can be more prominent in African Americans. They can be treated through a variety of methods. They're notoriously difficult to treat and may often require multimodality for the most successful treatment. Hypertrophic scars occur on the chest, shoulder, and earlobes of patients. They're caused by trauma to the skin, and the body will produce an overabundance of collagen or scar tissue. And you can see that the keloid becomes it's a benign growth, but it's still an overgrowth of scar tissue that extends beyond the borders of the natural or the original skin injury. They can be treated again with Kenalog injections, which is typically a steroid that's injected into the keloids, but can also require surgical excision, as well as radiation therapy or even cryotherapy. Keloids are notoriously difficult to treat and have a high recurrence rate. They're genetic in origin, and typically multimodalities are needed to help give the best results. So briefly, for caring for your skin at home, you want to clean your skin day and night. You want to remove your makeup before you go to bed. Men and women need to wash and moisturize the skin. Sunscreen is an absolute must, even for patients of color. If you develop folliculitis or acne, please try to avoid picking it, as that will only create more scarring and spread the infection. And then maintaining a healthy lifestyle, which is more easier said than done, by getting proper sleep, addressing nutrition, and minimizing your stress. Different treatments that can be done under the guide of medical direction include chemical peels, laser, microneedling. But I caution patients to make sure that they're going to a provider that is comfortable and familiar with using these types of treatments for patients of color. And so briefly, in summary, caring for black skin is, again, it's a variety of skin tones and texture. There's no one classification that will apply to all African Americans. We do have thicker epidermises, so that can lead to hyperpigmentation, acne, pseudofolliculitis. It increases aging. And so treating the skin, again, cleansing it and decreasing the inflammatory response can help be an important part for caring for your skin. Other conditions such as DPNs can be treated with laser or cautery. Hypertrophic scars and keloids need multimodality therapy. And these treatments can be done, again, at home and under a medical supervision. So I would like to thank Kappa Alpha Psi for inviting me to participate in today's lecture on caring for Black skin. I would like to send a special shout out to a very special Kappa in my life, my father, William H. Cash III, who was initiated in the Zeta chapter in 1964 at Ohio State University. And I give him a shout out, and I love you very much, Dad. So I have a special place in my heart for KA Psi. Thank you.